The PureSleep device is an FDA-cleared mandibular repositioning device indicated to reduce snoring in adults.
Snoring occurs when your airway relaxes and the tissue in your throat vibrates. PureSleep uses a technique called mandibular repositioning, which holds your jaw forward, gently opening the airway to stop your snoring.
Thank you for participating in this brief PureSleep fitting demonstration. Before using PureSleep, it is important to review the use and safety information found in our instruction and fitting guide. The device is contraindicated in patients who have central sleep apnea, have a severe respiratory disorder, have loose teeth or advanced periodontal disease, are under 18 years of age. Use of the device may cause tooth movement or changes in dental occlusion, gingival or dental soreness, pain or soreness to the temporomandibular joint, obstruction of oral breathing, or excessive salivation. Dentists should consider the medical history of the patient, including history of asthma, breathing or respiratory disorders, or other relevant health problems, and refer the patient to the appropriate healthcare provider before prescribing the device. PureSleep and its instructions are designed so that your patient can easily fit the device at home, thereby reducing or eliminating your chair time. Still, it is important to understand how to fit the device and how it works, should you wish to provide professional fitting services or answer additional questions for your patients. Before fitting the device, it is important to determine the user's bite type, as the device must be put in the appropriate setting before boiling. PureSleep is comprised of an upper and lower piece, with the upper piece having two small tabs in front. If your patient's upper front teeth slightly overlap the lower front teeth, that is a typical bite. Use the standard setting, which is the two holes closest to the front of the device. If the upper front teeth meet evenly with or behind the lower front teeth, this indicates an underbite, so use the two center holes. If the patient has a severe underbite, the professional setting should be used, which is the two holes closest to the back of the device. However, this setting should only be used upon the advice of a dentist. If the upper front teeth are slightly forward of the lower front teeth, this indicates an overbite. So use the two middle holes. However, flip the device over so that the top piece now extends out further than the bottom piece. Place the device in boiling water using a spatula or slotted spoon to hold it under water for 1 minute. Allow the device to cool for 14 to 18 seconds. Then, as quickly as possible, the patient should hold the jaw as far forward as is comfortable and place the device in the mouth while continuing to hold the jaw forward and bite down very firmly, and hold this position for 45 seconds. Please note, the teeth and gums may feel very warm during this process. Run the device under cool water to seal the impression. Trim away any excess material for greater comfort. Cuticle scissors work just fine. If a deep impression hasn't been made, the device can be reboiled and refit up to 3 times. However, once boiled, you can't change the setting, so once again, it is important to determine the best setting prior to fitting. Allow me to reiterate a few important tips to share with your patients. Most people have a tendency to move their lower jaw backward when biting down. However, doing so will result in an improper fit, so patients must resist this tendency. Please have your patients practice holding their lower jaw forward while biting down and to bite down firmly. Doing so will result in a deeper impression and provide greater retention and effectiveness. It is normal for the jaw to feel sore for the first few days or for the jaw to be a bit forward of its normal position in the morning. Jaw stretching and massaging the joint area will help the jaw return to its normal position. If patients wake up bothered by the device, they can wear it longer each night and slowly work up to a full night's use. Should patients experience any severe or sharp pain, advise them to discontinue use immediately and contact you. Thank you for your interest in PureSleep, the snoring solution that has helped hundreds of thousands of snorers and their bed partners get a good night's sleep. We hope that you find PureSleep to be an effective, affordable option for your patients. However, we do realize that PureSleep is not for everyone. Should you or your patients be unsatisfied with the device, we will offer a free replacement device or refund your wholesale purchase price within 90 days of purchase. If you have additional questions regarding PureSleep, please call us at 877-878-6346.
If it weren't for PureSleep, we would be sleeping in separate beds.